So good afternoon to all of you. So my name is Bart Orbijns. I'm working for the European Diabetes Forum. And this afternoon we are joined by, of course, country representatives, but also by Sabine Dupont from IDF Europe and by Elisabeth Dupont, both from IDF Europe. And so we will explain to you a new project. I will not keep it longer than that for the introduction. Maybe just to kick off with the objectives for today, we of course want to update you, inform you today about this important new European initiative, and of course then to explain to you the kinds of engagement you can have at country level. We have foreseen maximum 30 minutes of presentation, and we would suggest that we first present and give a few best practices, and then of course more than happy to take your questions and have a hopefully interactive discussion. So I keep it short. Sabine, over to you.
Thank you, Bart. Would you like to go on to the next slide? I will try to keep it short as well, so we've got as much time as possible for discussion. So in December 2021, the Commission announced the launch of a new initiative, the EU NCD Initiative, also called Healthier Together. And that took the diabetes community and actually the other disease areas community a little bit by surprise, because up to that point, the Commission had been quite adamant that they would not be looking at disease-specific policies other than the European Beating Cancer Plan. So the ambition of the initiative is really to support member states in identifying and implementing actions and policies that will help reduce the burden of diabetes. And the initiative will run between 2022 and 2027, and it consists of 5 strands, including one on diabetes. Next slide, please. So this is a very good summary of the way that the Commission is thinking about the initiative. The member states are being supported by the steering group on health promotion and prevention, and the SGPP organizes the inputs and the priorities of the member states. And each one of the strands includes, of the disease area strands, includes a focus on reducing inequalities. And there is a transversal strand on health determinants. But the focus of the initiative is very much on implementation. And there is within the implementation a great deal of attention being attached to best practices. But whilst the focus of the initiative is very much on prevention, and you can see on the side, there is a call out for screening approaches. So the Commission is really interested in figuring out how best to organize prevention and screening of NCDs. There is scope for broader action within the initiative, notably looking at improving knowledge and data, looking at optimizing tools for diagnostics, and also improving the quality of life of people living with NCDs. So if we go to the next slide. So the first step in the initiative is the co-creation of a document together with member states, which will contain a list of priority actions, as well as a map of the legal and financial instruments that are available for member states to finance the implementation. And the Commission describes the initiative as a toolkit to guide high impact action. So we don't really know how ambitious or what the final document will look like, but the way that they're looking at it is very much a kind of toolkit that member states can use to implement action in their own countries. And these actions can be, as I said, best practices, which is something which the Commission is asking all stakeholders to and member states to provide via consultation, but also via the health policy platform portal and the general best practice portal. The policy guidance will be complemented, as I said, by a mapping of those legal and financial instruments. And there are actually very many opportunities within the EU budget to finance action. So the main tool which will be used to finance the initiative will be the EU for Health program, which has a budget of 5.3 billion. But there are a lot of other initiatives, such as Digital Europe, which aims to shape the digital transformation of the EU. And that has budget, as I said, 7.5 billion. There is also the Recovery and Resilience Facility, which is designed to help member states recover from the impact of the COVID-19 pandemic, and also which is designed to help them strengthen their health systems. Other tools will be React EU, the Cohesion Policy Funds, and Invest EU. So if we go to the next slide. So the way the initiative is designed, it's very much a co-creation process between the Commission and member states, with input from the stakeholders. So the stakeholders contribute to the process through a health policy platform and a series of webinars. And there is a parallel consultation by which the member states meet through the SGPP every month, a few days before stakeholders meet with the Commission. And the process will culminate in May, June, with the publication of a consensus document. So the process is very much an iterative process by which the Commission is first building an inventory of policies, interventions, and actions that can be of interest in reducing the burden of NCDs. They're then collecting the priorities from the member states, and in a third step, they're clustering countries together based on the level of development and interest of the member states in collaborating. And those three steps will form the basis of the document that will be released in June. And then the fourth step will be the implementation, which is expected to start after June. And part of this will be included in the EU for Health 2022 work program. So if we go to the next slide. So the last meeting of the stakeholder group took place on the 17th of March and provided an update on the SGPP meeting, which had taken place a couple of weeks before on the 3rd of March. And essentially, the Commission shared the priorities of the member states as they stand at the moment. And the priorities are to integrate promotion, prevention, and treatment. There had been a lot of talk on the fact that the initiative would focus very much on prevention. 20% of the EU for Health budget is reserved to prevention. But actually, there seems to be some thinking that it's important to look at the entire disease pathway, life cycle. The second priority is very much to strengthen primary care, to invest in self-management, to reduce health inequalities, and to differentiate between the types of projects and action that can be implemented. So the Commission is now looking really not just at large-scale projects, but also at perhaps more targeted pilot-style projects that could be of interest. What also came out of this meeting, which actually gathered about 23 member states, was that all member states support a joint action on CVD and diabetes. And there is an understanding that there are differences, but nonetheless, there will be a joint action. And for that joint action, a meeting will be set up, a working group will be set up with an initial meeting taking place early April, but we don't really have much more information on that at this point. Next slide, please. So where the Commission is at the moment is they've started drafting the consensus document, and they're at the stage, based on the input that has been provided by the stakeholders and the member state, they're at the state of starting to present action options for member states to choose. As I said, the best practice sharing is central to the entire process. So I think from the viewpoint of the diabetes community, it's essential that we try to provide input to the Commission as to what actions and interventions could work in tackling diabetes. And the stakeholders that were present during the meeting agreed that there is a need for integrated approach, and that having a joint action between CVD and diabetes can work, but bearing in mind that we also need to leave space for disease-specific work. Next slide, please. So a summary of the recommendations by the diabetes stakeholders was also presented. And this very much follows the IDF Europe contribution paper that was already submitted to the Commission earlier in the year. But it also highlights the fact that the diabetes community is actually quite united in some of the key programs and actions that need to be put in place in order to make a difference. Next slide, please. So the last webinar was very much focused on diabetes and CVD. There will be 2 more webinars before the document is finalized, but they will be on the mental health and neurological disorders and respiratory disease trend, as well as on the health determinants. So from our viewpoint, what we can do is really to try to continue providing input via the member states, as well as directly to the Commission through the health policy platform. And there will be a closing meeting on the 22nd of June, which is also designed perhaps to be the launch meeting of the initiative. So I think that's a summary of what has happened so far with Healthier Together. I think we can move on to the next slide, Bart, and I leave the floor to you.
Yeah, thanks a lot, Sabine, to give us the overview. Of course, now it's time for action. And before going to that, you have just seen the overview that Sabine presented on the diabetes input. And some of you might be familiar with the input also the European Diabetes Forum gave. And you might have observed that there is indeed a very good partnership and overlap, I would say not by accident. And so the focus on health data registries is clearly in there. The focus on empowerment of people with diabetes through digital technologies is in there. And you also heard Sabine focusing on reinforcing primary care and integrated care. And then last but not least, also to ensure that there is a good screening and early diagnosis of both type 2 and type 1 diabetes. So without going much deeper in detail, I would say you have seen that the diabetes community is really united in this initiative. This is actually the last slide, and then we can give you a few ideas for concrete local engagement. So what are our suggested actions towards you? Of course, first of all, you know that we are connected at the European level with the people with diabetes community, with the research community, the academic community, nurses, primary care, I would say, name it, the whole community. And so we also suggest you do the same at country level and have a discussion with your peers and the diabetes community. I think Elizabeth will also refer to what she is doing locally with the IDF members. So we certainly stimulate you to do the same and not to go in isolation at country level. And then secondly, of course, beyond connecting on itself, which is of course a purpose, even better is if you can also discuss and align on what makes sense for your specific country, what are the needs, what are the priorities, where you could engage in this initiative. Then one step further, and we have observed that in the reach out we did to some countries, is that we really believe there is also a need to connect locally with your government officials, because as you heard, Sabine explained that there is a sort of parallel track where stakeholders like us, like NGOs are involved, but of course decisions will be taken by the member states and so by your government officials. So first of all, we suggest that you detect who from your country is represented there. Unfortunately, we don't have a list of the national members in this famous steering group on promotion and prevention. However, we can share with you the country representatives that are in the EU4Health program. And based on preliminary input, we see that often these people are the same, or at least they can connect you with the people who are working on this project. Secondly, we also believe that it's important to inform them about this initiative. Of course, you will hear that some countries are aware, but again, we have observed that some countries are not yet aware, and this is actually a missed opportunity. And so there you could play a crucial role. And then last but not least, also there, the input we have from some countries is that they are really open to also have your local inputs on what makes sense to work on in your specific country. So we give you a few examples, but I believe on top of the input we provided you today from European level, I believe it's also important that you make sure that you also make clear what the local diabetes community wants to work on. And last but not least, before we go into a discussion, we would also appreciate if you could share with us your best practices, your questions you might have after you have contacted locally, and of course, whether you were successful or not. Before speaking maybe on my personal experience with Belgium, maybe Elizabeth, I can hand over to you and to listen what you have done with IDF members and some of the feedback you were able to gather. And then we take questions, of course.
Thanks, Bart. So maybe very shortly, in terms of what IDF Europe has been doing so far with its member association, we really have kept them aware of the initiative since the beginning. So in January, we reached out to them with a description of the initiative, the objective. We provided them with a template to send to their health ministry to reach out to them and ask for a contact or an appointment. We also provided them with a list of diabetes priorities that were based on what we had identified, and which is also mentioned in the Blueprint for Action on Diabetes that has been published recently based on their input. So we really encouraged them to reach out to their government and make sure that people were aware of the initiative and that they could already contribute with some priorities. At that stage, we heard back from some of our member associations that the Ministry of Health were not informed. And so that was a very good way for them to provide further information. And by providing some further information about the initiative as a whole, to focus more specifically on diabetes and already provide some information about diabetes priorities. Then we, as a EUDF, we also shared our recommendation, provisional recommendation with the Commission. And we made it very clear that these were provisional because we were gathering input from the member association to make sure that national priorities would be reflected in the document. We then, after the first workshop with the Commission, hold a workshop with our member association to provide them with an update of the initiative, and also to make a presentation that is very similar to the one Sabine did to you. So if you reach out to member association, some of them have already been informed with and have seen this presentation. They all received a description and priorities and guidelines on how to try to approach the government. During that webinar, it was also an opportunity for some of our member associations who already were in contact with their government to share their experience with other associations, hoping that this would inspire them to follow some the same example. We heard from the Finnish Diabetes Association, for example, that they had been contacted directly by the Ministry of Health and were asked to contribute to the plan. Some others, like Bulgaria and Czech Republic, they reach out to their government, send them the priorities, etc. So to make sure that there was as much push from the diabetes community as possible. We also shared the revised recommendation with them so that after the webinar, they could reach out to their government with the revised version or start engaging if they hadn't done so at the time. So now we have, after the last webinar that was held on the 17th of March, we also went back to a member association with an update, as Sabine mentioned earlier, about where the Commission stands with the initiative at this point. asking them again to make sure that they are engaging and providing input to the representative on the SGPP, as Bart mentioned earlier. And one of the biggest asks that we have from our member association, but also from you, would be to identify the best practices that can support the priorities. That's really key for the Commission, to have best practices supporting the priorities that we put forward. So we already have some best practices, and I think in both documents, the one submitted by EUDF and the one submitted by IDF Europe, and possibly I think also by FPIA. But we really need to make sure that we have very strong best practices that would support the priorities, because that's where the Commission will have the most interest in. So that's a call from our side.
Thank you, Elisabeth. And maybe I can end this more presentation part by giving a very short testimonial on what we did in Belgium. So as I said, you will have the names available of people that are connected with Europe. And so what I did on behalf of the Belgian diabetes stakeholders, we contacted this lady, and the good news was that they were involved in the project with 2 experts on NCDs and also on diabetes. And then secondly, they were really open to have also local engagement. I would say for 2 reasons, and I will be a bit echoing what Sabine and Elisabeth have said. First of all member states give also input to the European project. So if you feed them with best practices from your country, they can also give it at EU level. But the second part is maybe even more concrete and a good opportunity for you. At the end of the day, these people will also decide what they will do in your country. And the good news is, we didn't mention that yet, but European Commission has foreseen budget for this project. And now they are looking for content. Normally it's the other way around, but they have budget. And so I remember at the opening session, the Commission said, we are afraid that the money will not be used by countries. So I think there is your opportunity also to say to your country representatives what you think as a community is important for your country. And I can tell you already in Belgium, they came back to us and they wanted to hear also from us what, because you have seen, for instance, 5 key priorities. Let's be very realistic and pragmatic. If they can implement 1 or 2 projects in your country, I think it would be fantastic. But my experience is that they were really open. They came back to us, to the community, to ask, what is it you want to see us subscribing to? And I think that would be an excellent exchange if you can also reach this objective. On top of that, it's not about just feeding them, but if you do this with them, if you set up this local engagement, they will also be happy that there is a community behind it that can implement it. Because I think, Sabine, you mentioned as well the importance of implementation. If they feel there is a community at country level ready to support and to act on it, I think this is really what they are looking for. That is my experience from Belgium. I wouldn't see why it would be the case